Hi, everybody. Welcome back to Perspectives. To our followers, thank you so much for tuning in. And to our new listeners, as always, welcome. On Perspectives, we discuss various human resources and industrial relations topics within the workplace from both a millennial, me, and a boomer, John, points of views. We discuss topics like the ongoing global pandemic and employment, human rights in the workplace, health and safety measures, unionization, and so much more. So today we're going to dive into the world of mandatory vaccinations, a very hot topic right now across the globe. Can employers require staff to get the COVID vaccine prior to returning to work? Can you write a mandatory vaccination as part of a terms or conditions in an employment contract? Where is the line for employers to take all reasonable measures in ensuring their staff are safe without overstepping lines of privacy, human rights, and individual beliefs? The list goes on and on. So, John, to start off right out of the gate, can employers require their staff to get a COVID vaccine once it becomes publicly available?
And thanks, Joss. Thanks for reminding me again that I'm old. Excuse me.
You're only as old as you feel.
So let's talk a little bit about the mandatory vaccine. I think what's happening right now is we're starting to see a fair bit of commentary on mandatory vaccination of staff because of the concern in terms of the possibility of bringing COVID-19 into the workplace. So let's try to understand some facts to begin with. And I think that always is, frankly, the best place to start. So let's start with fact number one. Employers have the right to establish reasonable rules of conduct, reasonable rules as relates to terms and conditions of employment. So that's the fundamental test for anything that we do. And when we talk about reasonable as it relates to, say, COVID-19, I think it's safe to say that reasonable should take into consideration public health issues, occupational health issues as well. So that right is there. So that then takes us into the vaccine and the vaccination process itself. So what do we know at this moment in time? What we know is that there are a number of vaccines that are available or will be available. You know, we have the Pfizer that's already underway. We have Moderna that's already underway. We have AstraZeneca, which is on its way. And then, of course, we've got Johnson & Johnson. That's another possibility. Bottom line is the way that certainly the government is discussing this, by September of this year, there's going to be plenty of dosages available that everybody in Canada can get vaccinated. So we know that. What we also know at the same time is they're extraordinarily slow to administer the vaccination into people's arms. So even though we already have a lot of doses available in Canada, our ability to administer it is extraordinarily slow. Now, it would appear that they're going to try to accelerate that process. Great. But it's important to understand right now, not a whole lot of people have got that vaccination. So that to me is a very, very important part. There's a lot of people at the same time who are not interested in getting vaccinated. And they're not interested for any number of reasons. Whether they essentially challenge the science of it, they feel it was too fast. How can they possibly have been able to accomplish this in such a short period of time? So there's a question in terms of the science. Then we've got the other issue involved with, are there going to be potentially side effects? Now, we don't have any experience whatsoever with the result of the vaccinations. There's no history. We cannot reference anything at this point in time. History is going to be made as people are getting vaccinated, so to speak. So we're faced with that problem as well. How long will it last? No idea at this point in time. So we have people who don't want to take it. They're a little bit concerned about it. We don't know how long it's going to last. We don't know if there's side effects. So that in itself, in my opinion, is probably producing that big question mark. Can we now mandate people to have the vaccination? And I'm going to suggest it's highly premature, this conversation. I think it's a fair comment to have. Once we understand what the most fundamental part of all this is, does it prevent transmission? We do not even know that fact. That has not yet been established. All we know is that it diminishes getting sick for those who receive it. It does not talk at all, and nobody has talked at all about whether it prevents transmission. So I consider that probably to be the most important part of even the conversation around mandatory vaccination. Because if in fact it does not prevent transmission, then in my opinion, it makes it even more arguable that this is not reasonable to expect mandatory vaccination, even from a public health point of view.
So do you think that certain industries, all that being said, all the things that we do know about the vaccination, which is quite minimal, we, as you mentioned, we don't know long-term effects, but I do know in certain industries like the healthcare industry, some healthcare professionals are required to get vaccinated before they start their job. Now, I agree with you that I think that is extremely premature to have this conversation now, but I actually can foresee a future in which healthcare professionals will be mandated to get the vaccine. However, I do not foresee a future where an office worker or an hospitality worker, I would argue that would be unreasonable to mandate that, regardless of in a couple years, regardless in, over time, because you can't force people or coerce people into a minor medical procedure. You just can't.
Well, that's where I think the jury is out. But to your point, the healthcare workers already are mandated to have the COVID-19 vaccination. And indeed, in the healthcare environment, the world of where we've got the most vulnerable long-term care facilities as well, yeah, they are in fact mandating it, and they can mandate it. And the reason they can mandate that is not even so much on the transmission side, but to ensure that the people themselves are protected. So because their exposure, the likelihood of basically getting COVID-19 is far, far greater than we who are doing everything that we should be doing, social distancing, isolating, wearing masks, all of that. They themselves are a very, very vulnerable position. So they can, basically mandate it. They have mandated that in healthcare workers as it relates to the flu vaccine, the same thing. So we've already got that history, and you can't take a cookie cutter approach to this subject. But what we can do is talk, to your point, that those people who would otherwise consider the essential workers, such as in the healthcare, long-term care, yes, they should have it mandated. Yes, they should in fact be front of the line to get the vaccination for their own health. As it relates to people in an office setting, I agree. When we're in an office setting and a person chooses not to have the COVID-19 vaccination, and we also know that it does not prevent transmission, I think it's going to be highly difficult to mandate that they're going to lose their job if they refuse to get the vaccination, because that's the outcome. They're going to have to lose their job. As I said, there's some lawyers that are talking about this publicly, saying, yes, you can do this, but it's premature. And that's really the most important message that I'd want to see conveyed out there. I want to have this conversation. Let's get some history with the vaccine. Let's understand how it's impacting. Let's get our economy going. I think it's a conversation that should be had at the end of 2021 at the earliest, and no sooner. I would not recommend anything around mandatory vaccination in those industries that are not what we call essential industries at this point.
Yeah, well said. I mean, I think too, but when it comes to essential workers or essential industry, we talked about healthcare and long-term care, but where's the line? So if you're a police officer, should you get the vaccine? If you're a firefighter, should you get the vaccine? And it's a really difficult and a gray area. But I can foresee a future, as I mentioned, with healthcare, that this would almost be a bona fide occupational requirement. So for those of you who don't know what that means, it means that employers are technically allowed to discriminate against people on protected grounds for the purpose of their job. So as an example, if you're a pilot and you're blind, your employer doesn't have to hire you because of the fact you're blind, because it's bona fide for your job. I can see a world in which the vaccine could be part of that umbrella. But I also foresee, again, to your point about the end of 2021, like if you're an office worker and you don't get the vaccine and your employer forces you to or makes this policy around it and you quit, you can file. Like I can see a world with filing human rights complaints, constructive dismissal, all that. And it's best to just avoid that. Avoid it.
I think that's a really, really good point. I mean, when we talk about B-Force or bona fide occupational requirement, it really is one of those things that probably would have to be subject to the big test. And that test is back to this issue around reasonableness.
Mhm.
Anything that we were talking about is what would a reasonable person expect to happen here? So if we do know that the vaccine prevents transmission, if we have that history, that data, that's unequivocal, not ambiguous, unequivocal, then I can actually see that it might become a bona fide occupation requirement, even in an office environment, because we obviously do not want to see an ongoing pandemic underway with us. I don't think that we can possibly contemplate that just yet.
Yeah.
And I would be really, really careful. I mean, recall the flu vaccine's been around for a long time. You know, not everybody wants a flu vaccine. It's
Yeah.
never been mandated, even though allegedly it prevents the flu from spreading. But even that is not necessarily true because it depends on what variation of the flu that we're talking about and whether that particular dose applies. So you'll find that most organizations don't have a mandatory flu vaccine approach. And yet, in this particular case with the coronavirus, we are going to. I think we have to take a look at some history. And as I said, it has to, first of all, withstand the test of time. We need more information, more data.
Yeah.
And this is a conversation that we should probably have again towards the end of this year.
We'll count on it. We will. At this point, though, I do want to kind of shift a little bit because even though our thoughts about the vaccine as it is premature, as you mentioned before, there are lawyers out there saying you can mandate the vaccine, do it. It's smarter, it protects your workforce, yada, yada, yada. And so many employees and people are talking about the vaccine. So what happens in the opposite effect? What happens if you have somebody on your staff who is refusing to come back to work because they don't feel safe coming into the workplace because there is no mandatory vaccine policy? What do you do?
Okay, so let's go right back to the very beginning in terms of what our obligations are as an employer related to occupational health and safety, which, at this point in time, we talk about public health protocols really as a foundation for your internal occupational health and safety protocols. If you've got those all established, then it's a matter of, and you do not have the mandatory vaccination requirement, and an employee chooses not to come back, given the lack of evidence around the impact of having a vaccination, I would take probably a strong position to insist on that person coming back, no differently than a person says, I feel unsafe coming back because I just don't feel safe coming back. I would treat it no differently than that. And I'd say, if you are not inclined to come back at this point in time, because we do not have a mandatory vaccine regime established, then I'm prepared to accept a resignation.
Yeah, I agree with you. I think that, the workplace refusal is I don't feel safe coming to work because I don't feel safe. You can't refuse sight unseen. And it just goes back to our earlier messages and our earlier podcasts about involving the Joint Health and Safety Committee, getting an occupational health and safety plan in place. That is government mandated. You need to have an occupational health and safety plan in place. So if you get audited, you can showcase that like this workplace is safe because blah, 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 blah.
Absolutely.
So I think that's a really good point. My final question, it's a little bit of a funny question. If a workplace is unionized, so for those of you who may be kind of new to the union world, unionization doesn't mean that the entire staff needs to be part of the union. They don't all need to be members. Sometimes unions they only have members in certain departments. Sometimes they only have members in certain locations, or the entire staff is unionized, however you want to slice and dice it. But if the union is imposing that their members get the vaccine, what place does an employer have in that relationship to kind of jump in, or is it really none of their business?
Well, frankly, a union has nothing to do with the workplace as it relates to the establishment of rules and regulations. That's the exclusive domain of management. So I really don't care what a union might say about it, other than to say, well, I'm interested in your thoughts on it, and we'll take that into consideration as we take a look at how we're going to deal with our employees. How you choose to deal with your members, we probably suggest to you that you probably limit it to their membership obligations as it relates to anything related to the workplace. Appreciate our respective roles. You have a responsibility to represent your member, our employee. We have a responsibility to establish rules and enforce those rules. And you can hold us to the test of reasonableness. And if we're screwing up on that, you've got a grievance procedure and you can go to arbitration if necessary.
All right. So all you unionized workplaces out there listening to this, they are your employees. The union wants to impose a mandatory vaccine for their members. That has really nothing to do with your workplace.
Perfect.
All right. Well, thanks, John, for your stories and your feedback. I always enjoy listening in our conversations. We discuss these types of topics through our social media channels as well. We also post important like compliance updates, different measures that the government's taking, not only just with COVID-19, but any changes really that happen in every jurisdiction in Canada. So if you want to check us out, that would be great. Give us a follow on Facebook, LinkedIn, Twitter, or YouTube, or all of them. So thanks, John. Stay safe and stay healthy.
Thanks, Joss. Talk to you.